wanted to make sure that we record this for everybody who is not here tonight. And this one's kind of fun. We're talking about non-contact ACLs, which in fact, Chris, one of our students, so eloquently after class, he was like, why do I see a lot of non-contact ACLs? Whenever I look at things, I'm seeing a lot of those. And he was completely and totally right. And there's a few reasons for that, and we'll discuss those today. I want to give you a little bit of an overview. So let's just talk about what we're exactly going to be talking about and then go from there. So I'm going to take this out of slideshow format just so that it doesn't do the scaling thing that drives me crazy. So what we're going to focus in on today is the background purpose, why we're talking about this, and why I have a conversation with many coaches about this. Women in general, I usually have to have conversations about this topic. And then we're going to discuss the anatomy, some injury mechanics. I'm actually going to follow up on an email with the link to this video, as well as a link to a few injury videos, because it's kind of sad to say, but it's always fun to see somebody snap their ACL because it is a very noticeable injury. So I'll send you a couple of those. And then why females? Why are we seeing more non-contact female ACL tears? We'll talk about recognizing the problems, implementing some preventative measures, and then some research-based outcomes. So if you guys have any questions during this, please feel free to stop me. Otherwise, we're just going to go ahead and dive on in. So in 2004, granted it's 2020 now, so we've actually moved this up. I think we're now third. ACL reconstruction surgery was sixth highest in 2004. Nowadays it's about 4.3. It's kind of crazy how many you will see of these. Even in my short time at Advanced, I rehabbed a few of these, as well as saw my coworkers rehab a few of these. They're just so prevalent, especially in our soccer players, because that was the season that was mainly coming in whenever I was there. So it's really interesting just to see how many we get. 50% ages 12 to 25. And if you think about developmentally, those times are very crucial because there's a lot of hormone changes, there's a lot going on. And so it makes sense and adds up that it would be around that time. So I took some of these numbers from the ISS. This is 100 NCAA schools. They reported some injuries, and I just kind of like these data numbers. I'm probably actually going to update them next year for next semester. But I did like this because it gave you some frame of reference, and it wasn't just like one team, 1 year. It was actually over multiple years. So I liked how they did this collection of data. But like I say, it's a little bit old because it's 2004, but the numbers still stand up. They are still very, very prominent. And in fact, I want you to think about it. These were back then. This was 2004. It has only escalated from there. So whenever you see these numbers, add a few more on there, because it's totally true what we've been seeing with the data now that they're going to be coming out with the next one. It's definitely increased. So as we kind of go through, keep that in mind. Okay. If you have any questions along the way, please shoot. Okay, so let's just talk about different sports. So this is another reason why I like this, because they grouped it in different ways. So let's just kind of talk this out a little bit. In men's basketball, 60% of all injuries that they saw there were lower extremity, okay? Now, with these, when they were actually seeing these injuries, it would be in practice, ankles and knees, versus games, ankles and knees, okay? So you see those numbers right there. Pretty close, right? Nothing big, major here. You'll see these numbers change later on with football, but still. Look down below that. It says how. So at practice versus at games, those were the numbers, percentages that they were seeing with injuries. Then you drop down to 60.3% of game ACL tears were non-contact. So just for ACL tears, non-contact during games, it was 60% of that. So it's a big number jump that we see whenever we highlight these injuries. Going on into football, 50% were lower extremity, which makes sense, right? Like there's a lot going on in football. But as you can see here, higher occurrence of knee now. A little bit less ankle, which makes sense because in basketball we see a lot of sprained ankles. But in practice and in games, now we're seeing a higher prevalence of knee. And then we go down here to these numbers, right down chia, ACL non-contact, game versus practice. Higher prevalence of practice, which to me kind of makes sense because a lot of times I've actually seen several in my short career of non-contact ACLs in practice. And I don't know if it's because it's lax or what's going on, but a lot of times you will see that, plus they practice more than they play, right? So you're gonna see that number be higher, okay? Going on down, let's talk about women. So 60% lower extremity, ankle and knee, which we saw before, but of course we see the higher prevalence of that ankle. 63.8, so that is higher than the gentleman of ACL tears non-contact. So I think we were at 60.3 for gentlemen's basketball. Now in ladies basketball, we're seeing about 63, okay? And then women's soccer, this is the one where we just see it skyrocket. We just start to see a lot happening. So whenever we see injuries, you know, we're seeing how are they injuring them? Well, you know, some were in games, some were in practice. Soccer, we practice a lot. So that means that you're going to see an injury occurrence be higher in practice. That's just common sense. However, whenever we're talking about games and whenever we're talking about ACL tears over non-contact, look at these numbers with me. So that means that every ACL tear that you would see, over half, no matter if it was practice or game, would be non-contact. So that means that you cut wrong, you landed wrong, you pivoted wrong, something like that. So what I'm saying with this is there's a lot of things that can happen in a game, in a practice. Usually, you know, you see a lot of tears, you see a lot of injuries occur whenever somebody slide tackles you wrong or somebody hits you or something of that nature. But whenever we're seeing these significant numbers with non-contact, it tells us that we're dealing with something else, okay? So why should we understand these? We need to know, for the health of our athletes, understanding why these injuries occur, the predisposing factors, and that's the biggie, and then how to train specifically to avoid these and then to prevent them, okay? So we've dove into a little bit of this anatomy. This is just more of a refresher. Obviously, we have that ACL coming in, preventing that anterior translation of the tibia. It also, it helps whenever it prevents that inward rotation because of the placement of the ACL. So we see it right here coming from the back anteriorly to the tibia. And so that just helps us not rotate. But as you can tell with what I was saying earlier, I said maybe you planted or rotated wrong. Whenever you have too much of that rotation and not enough strength to back it up to keep it safe, that's where you get the ACL tears there as well. So let's talk about how can you injure your ACL non-contact, okay? So you can injure it on landing. Poor Miss Vaughn, she has done so much to her body, but ACL has definitely been a part of it. But whenever you bring yourself into this crouched position that they land in all day in and day out whenever they're at practice or doing whatever they might be doing on their runs, you get into that deep knee flexion over 90 degrees. That kind of opens up that ACL and it kind of puts it on a lot of tension already to basically set you up. So if you don't have the landing mechanics quite right, or you hit something wrong, or one leg lands early, something of that nature, it does open you up for a little bit more of risk. But then you just have, well, guess what? You actually don't have the strength and your landing mechanics are terrible. Can we just acknowledge the fact that how bad this looks? Now, I will say that, you know, that's obviously not how we want to land, and I hope that I never look like that whenever I'm landing, but who knows. It's one of those things where whenever we have this excessive valgus at the knee, we put that strain, we put that pressure on that knee. Now, that being said, I love looking at alignment, but I also have the respect for the fact that alignment is not always the thing that needs to be nitpicked. Just look at any Olympic weightlifter. However, there are certain things that we need to consider, especially whenever we're talking about ACLs and landing mechanics, okay? There's different things, especially in women and ladies, that this valgus can indicate, okay? So whenever we're landing down, you know, our hips fall inward, knees fall inward, foot falls inward, because there's no structural support or muscular support there to support that action. That's where we open ourselves up for that injury, okay? Then, of course, we have that plant and cut, which sucks whenever we're talking about somebody with football or soccer. Because whenever you have that plant, and you do it every single day, and I think that that's what's so frustrating for athletes. They cut, they plant, they cut. They are guarding somebody. They're doing these movements every single time they're at practice, and yet one time their ACL goes. You plant that foot, maybe it's a cleat, so it's stuck in the turf or grass, and the leg is almost straight. This is where we see it the most. And then your femur, so your upper leg, rotates out. Well, because that foot is planted, the lower leg, your tibia, stays right where it is and rotates in, okay? That's basically the recipe for an ACL tear, probably meniscus too. We see it so much, it's frustrating. And you think about it whenever we're talking about these different professionals, and I'll send you guys links with these different injuries. It's sad how you can like see it happen, but you see them plant, you see them cut, and for whatever reason, that day ACL goes. Now we can, like I said, we can talk about form, we can talk about fatigue, we can talk about all these different things. However, we also have to factor in this thing called life. It does happen. And so with anything, whether it's sport, play, you know, playing with your dog, playing with your kid, doing whatever the case might be, life does happen. And so you might have done that action a billion times before, and maybe that day it just didn't hold up, okay? I'm going to play one for us, just because you have to. I mean, it's just kind of fun. Whenever I share this with us, hopefully it will allow me to. Maybe it will, maybe it won't. Let's see. I just grabbed a basketball one, because usually we see all of the football ones. I think I added everybody in. Okay, so hopefully.
Wary of putting him back in.
Bam, right there. Yeah, your knee's not supposed to do that.
Right away.
So whenever he hit the ground, you can see right there. So his foot planted, you can see his tibia is still facing forward, but see how his femur rotates in? Now for him, that was a plant. Not so much really a cut, but he was going in one direction while his foot was going the other. Again, he's probably done, I know he's done this layup, this type of shot, this plant a billion times before. But today, we got that. And you can see that anterior translation of the tibia right there. So like I said, this can happen so many different times, so many different ways. That's just one of the many. And like I say, I'll send you some fun videos, because sometimes just seeing it different ways. There's a couple of fun ones with in football, where you see that anterior translation of the tibia. And a lot of times there's a lot more happening. So it is interesting. It is one of those things that does happen. But like I said, yes, we can nitpick his form. That one time it was bad, right? Whatever the case might be. But again, keeping in mind that life does happen. And these guys are the best of the best at what they do. Okay, but it's still, you still see these things. And I'll send these links to you as well in the PowerPoint follow-up as well, okay? So now let's talk about why females. So anatomically, we have differences, and then also hormonally, we have differences. I always like to put this out because usually I'm having this conversation with coaches, strength coaches, whatever the case might be, maybe parents. So I always like to point this out because especially with the numbers that we're seeing coming in with this round of data, you know, you saw the old round, but the ones that we're seeing with this round, it's basically letting us know that ladies are seeing a high increase in their ACL tears. And I can attest to that for the ones that I have been seeing in my profession. So that's why it's so important whenever we have these conversations to point that out, because the data backs it up, okay? So anatomically, we talked about the Q angle, how females have naturally a greater Q angle due to our wider pelvis, hips, and how the femur comes off of the neck of the femur. So like the shaft comes off the neck of the femur, excuse me. And then also we have to think how women, we have cycles, okay? And so that means that there's going to be estrogen dominance versus progesterone dominance, vice versa, and times of dipping in the testosterone as well. That can set us up for being more at risk for injury. That doesn't mean that we're going to get injured every single time in a certain part of the month. It just means that it does set us up, okay? So biomechanically, women, even though we have those wider hips, we tend to have weak butts. Like, let's just be honest. These hip muscles that should be in full standing and should be able to support us a lot of the times, especially with our sedentary lifestyle, as far as being students, as you guys can attest to, we're sitting a lot more. So we're seeing whenever these ladies are landing, they have an increased knee valgus. They have, especially whenever they're doing box jumps, that's like, it highlights it. Side steps, you'll see it though. So even in their agilities, that's something that coaches really need to just take a visual stock of. And then also with cutting, because that's a real world application, right? If your knee is going every which way, especially medially, whenever you're cutting in practice, 9 times out of 10, whenever you're full speed at game or whatever the case might be, it probably looks that much worse. So with this, you have this unanticipated cutting, you see those mechanics faulty, but then also decreased knee flexion angles in landing. So basically, we're seeing a lot of females that don't absorb that shock. Instead of going in and landing and kind of falling, I don't want to say falling into the squat, but absorbing that shock into your squat on that land, they're kind of landing a little bit more stiff. And so you see that a lot, especially as you go into your profession, start noticing it and you'll see it. Which this means reduced activity of the quads, hamstrings, and guess what? You're going to feel that ground reaction force a lot more, okay? Now for females, we see it about the same across the board on our landing GRF, but with males, obviously after puberty, they usually have that testosterone boost coming up with the muscle, and you usually see that decrease a lot. So females, sadly, we don't get that boost that gentlemen do, but you will see that in your landing mechanics as well. Also, like I said before, with the abductors, so the hip muscles, the deep hip muscles that we really, really need, they're not firing as well. We see that a lot more in females versus males. Now, I'm picking on females, but I've seen a lot of gentlemen that we need to work on those abductors too. But again, getting them to fire appropriately to where we don't have that knee valgus is key. Again, these are the best of the best at what they do. And you see this in Olympic weightlifting a lot where you see that valgus. So that's a biggie, a conversation that we need to have. However, whenever we're talking about absorbing these landing mechanics, it's really, really needs to be highlighted. Dominant side versus non-dominant, males versus females. How much abduction are we getting actually? Non-dominant, how many injury, how much are we seeing these injuries increase, dominant side versus non-dominant side? A lot of times that non-dominant side gets a little bit of a higher risk chance, and a little bit less abduction because it does not have that abduction strength, okay? Also, if you think about it, females, guess what? We have smaller and slower quads and hamstrings than males. And that's just due to hormonal differences and, I mean, mechanics. But if you think about with our wider hips, plus the slower to activate quads and hamstrings, it does really set us up for a little bit higher risk of ACLs, just because we want those hamstrings and quads there to help support and prevent that anterior translation. I know that I'm picking on females, but last thing here, before puberty, girls and boys, we pretty much have the same strength in our quads and hamstrings. But then after puberty, the data has shown us that it sucks for women because girls, we see an increase of about 44%. Whereas gentlemen, it's 148% in quad strength. It's kind of unfair. Then of course you have hamstring strength. Girls, 27% increase, and that's why I like to, with women, really focus on hamstring strength because I'd like to see that number higher. And then of course, gentlemen, we see that one's way higher than quad strength. That's because we need those hamstrings to be stronger. A lot of women are more quad dominant than hamstring dominant. So I'm making sure that we build those hamstrings up. Even though we won't get as much as the gentlemen do, we need to get that number up even higher. Now, it's not just with females. This is a gentleman. It's actually from where I graduated high school. It's kind of funny. I didn't even take this picture. This is the prior athletic trainer. And I even know who this is, which is kind of crazy. But he was doing a squat, and he had somebody behind him shadowing him, or not shadowing him, excuse me, spotting him. And as you can see, that's not optimal, obviously. His control was all over the place. The abductor strength was non-existent, and it was evident here. So it's not just ladies, okay? So any questions as far as before I continue on, because I know I've been going for a while, you guys. And there's a couple of you, so yay, I'm not talking to myself. That makes me happy. Thanks for dropping in. But yeah, so as we kind of go through here, if you have any other questions, please let me know. Landing mechanics. So with this, you know, we might try a box drop, see what their valgus is, just to see what we're looking at, see what we're dealing with. We might do a max jump test, just again, to see what we're dealing with a player or somebody like that. So a lot of times whenever if in a perfect world, I would say an athletic trainer or somebody who has a good eye for this needs to be kind of screening athletes at the beginning of the season, just so that they can start pinpointing, okay, what type of mechanics do we need to start fostering and start really honing in on? What are we lacking in? And a box drop is a perfect way to do that, because we'll be looking for things like that knee valgus, that shallow flexion, and then them sounding like elephants jumping off of the box. I always joked with my patients, and still do, that I don't want you to sound like a herd of elephants jumping up and down off of the box or doing anything like that. You should be able to absorb that a little bit more. And if you are doing that shallow angle, you're going to sound like a herd of elephants. But if you get deeper in that squat and absorb it correctly with your beautiful, strong muscles that you have, you'll see that loud thud decrease. Quad dominance, we see a lot definitely in females, and especially in soccer players. I've noticed even whenever I played soccer, you would see, you know, they used to call them thunder thighs or whatever the case might be. I'm talking about myself too, because that's what we used to joke about. Misty said, I have to say to all of my dancers when we work on jumps and leaps, no offense. Exactly, because dancers especially, and that's funny that you said that, because I always think about ballet and stuff like that whenever I'm telling my patients. I'm like, okay, I want you to pretend like you're in the ballet, and whenever you land, You're landing on that hardwood. And if you don't use your muscles and absorb that, it will sound terrible. So try not to kill the puppies, no herds of elephants, and land and absorb that. So that's a good point, Misty. I like that. But again, back to the quadzillas here. A lot of times we'll see that quad being very prominent, but then the hamstring is just non-existent. You want to have hamstring strength about 75% of quad strength. If you think about it, the quads are bigger, there's more of them. Quad means 4, hamstring have 3 muscles. So, you're knowing that you're going to have a little bit more, because guess what? You have one more. That's why, hint, hint, you get 75% instead of 100. So with this, you know that you're going to have a little bit more of quad strength automatically. But I can tell you from experience that you see quads being just hammered instead of focusing on the hamstrings, which help prevent that anterior translation of the tibia. So it makes sense that we need that hamstring strength even more. It prevents what we're having problems with. And so I can, with 100% certainty, tell you that usually whenever you see an ACL come in, you will see a deficient hamstring, okay? And then also, leg dominance. So whenever we see this leg dominance, everybody has a favorite leg. It's kind of like your favorite hand, right? Are you left-handed or right-handed dominant? What do you write with? Yada, yada, yada. Do you shoot with your left or your right? Whatever the case might be, you're going to see a difference in strength because one gets used more. It's just plain simple. But what we see is that increase in ACLs, especially non-contact, happening whenever there's a strength deficit of more than 20%, okay? So if we're seeing that and we might be measuring that at the beginning of the season, we know that we need to work bilaterally. We need to make sure that we are working on a single leg stance for exercises of strength, just to make sure that we're not favoring one versus the other. So thinking about recognizing these problems, guess what? We look at the risks, okay? That's the first column. Then you got to think about, okay, so how do we fix it? Or what do we need to fix? How is it better? How can we improve this? And then how do we do that? How do we coach them? What do we focus on? So we need to focus on that soft landing, controlling the landing. I cannot tell you how many times I've seen somebody land and it's like their knees just bounced all over the place. Controlling that landing, knowing where your body is in space, making sure that they have some balance training, because a lot of times that's one of the first things that we have to build back in because it was lacking so much. And then of course, agility training. Whenever we're doing ladders and stuff like that, making sure that they're doing them appropriately, not just going through them, which I was guilty to in the past, but now I see that it's really, really key that whenever they're doing these things, they're focusing on their form. You're teaching them proper mechanics, keeping those knees in line, things of that nature, just to, whenever they're doing it in practice, it'll transfer over into the speed and game. So here are some preventative things that let's talk about pre-season. Obviously, guess what? We're going to be working that hamstring. We're going to be getting that ratio a little bit better. 9 times out of 10, you'll see more of the hamstrings are in the 40s compared to the 70s. So a lot of times starting this pre-strength, you need to do it pre-season, okay? And then of course, abductors, so stuff like monster walks, these banded exercises, whatever the case might be. My personal favorite is a side glute bridge. Whatever the exercise might be, just integrating that in this season, before the season, excuse me, so that you see the benefits during season. And then also just talking about athletic position. And why? Because we've all heard that baseball coach that's like, get down, and even yells it at the top of their lungs. And a lot of them, the players kind of roll their eyes or whatever the case might be, but explaining to them why, because we need to get them in a little bit more of a, I don't want to say safer position, but a more optimal position to where they can use their musculature appropriately. So explaining to them that this athletic position will actually improve their performance, will improve and decrease the chance of their injury. talking about, you know, okay, so how do you get from an athletic position jumping up and back down? Like talking about how that transfers to wall jumps, getting them to start wall jump, getting them to start tuck jump, seeing how their landing mechanics are there and applying it in that athletic position finish. And then of course, squat jumps and all that fun stuff. Then you can start moving them forward, trying to get that broad jump, making sure that they have those good landing mechanics there. And then the fun starts whenever you start doing rotational. If you think about back to whenever you were in sports or you were in practice, whether that was dancing or whatever the case might be, maybe you did some of these. Some of us did, some of us didn't. The ones who did, we were actually more prepared, because at least if we did have any sort of cut or spin or anything like that, at least we had practiced some of those movements beforehand, whereas a lot of women and men go into it kind of blind. And then also balance and proprioception. So we need to make sure that we're doing this preseason. We want to make sure that that is solid, that there is some awareness there, especially in developing, you know, that 12 to 18, 19, 20, 21 age range. We need to make sure that all those proprioceptive capabilities and balance is in high gear. And of course, some fun agilities. Might start adding in some plyometrics to switch things up, whether it's lateral, multiple jumps, in and out ladders, whatever the case might be. Now, with this, these are old stats, and like I said, I'm going to be updating them this season for next year's. And I can say from the research that I've been doing that these numbers are just scratching the surface. It's gotten even better. We've seen that whenever we're actually doing preseason programs, we're actually implementing these strategies with our strength and conditioning coaches and working alongside them. We see the incidences drop. Whereas we see the ones, maybe we're just gathering data at some schools. We see the ones who are not implementing any sort of preseason programs, we see their numbers increase compared to the ones who did. So it's just one of those things where the numbers, the data doesn't lie. A lot of times it can be like, oh, it's just that stupid exercise program that somebody put together for us to do, and it's just going to eat into my practice. Well, no, coach, actually, this is going to keep your star player longer in game. You can either risk the ACL potential, or you can do this on the front end to prevent that later on. So it's having those conversations and having the data to back it up. And then of course, in season, making sure that they just do a little bit of prep, warm up, stretching, strengthening, plyos, agilities, just getting the muscles firing and going, whatever it might look like. And it's gonna look a little bit different for each sport or activity, but just making sure that they're moving in different directions. They're getting getting stuff firing, getting stuff going, making sure that they do some stretches as much as they hate it, just doing a little bit. I like more dynamic at the start and then more static maybe at the end, but also just doing some basic strengthening exercises. You don't have to go into the weight room, especially for soccer or somebody like that, every single day. We just got to keep single leg strategies, single leg strengthening, things of that nature going throughout the season. Nothing crazy. And then of course, warming up with some plyos, warming up with some agilities, getting things done. It can add to your warm up. That way they're more ready to go whenever you start drill, no matter what the case might be, soccer, football, basketball. I don't care what sport it is, this would apply. But just making sure that we've built this in at the start of practice to where whenever you get into, the season, like you're getting into where you're maybe making playoffs, and how many kids do you have on the bench with injury versus not because of this PEP program? And it's pretty substantial. So these are old data numbers, but the data numbers still ring true throughout. The research that I've been doing recently on updating this PowerPoint, the numbers are still high. Like we see that decrease. And the more and more we get coaches on board, we see them decrease even more. So again, just to review some of this because there was a lot of information. We see a lot of ACLs, guys, a lot. And it's unfortunate, but it's become a real problem. So we need to start taking proactive steps. We need to start looking at who's at risk, who's not, what things predispose us. Namely, females, 12 to 25, 6 times more likely to tear an ACL versus males. 6 times. It's insane, but true. Most athletes in general do not have the strength in those hamstrings and abductors to actually hold up to their demands. A lot of them can get away with it for a while until maybe somebody comes up and actually helps them, but it does put them more at risk and does put more wear and tear and tension on those ligaments and the structure itself. A lot of athletes, especially if you're thinking, think it back to yourself whenever you're like 12 and you're awkward as heck, right? Like you don't usually know where your body is in space. Plus all the hormones, plus puberty, all that fun stuff. You really don't have that control for dynamic stability. You don't have the balance. You don't have that just lower extremity control in general. So having that proper strengthening, agility, balance work, stretching, just education, even a little bit earlier on, really, really shows to reduce the risk of that non-contact ACL. Because you can't control whenever somebody slide tackles you, right? You can't control whenever somebody hits you funny or they do something weird that like you just were not expecting at all. Those things, that's life. That's what pro athletes, they are. Think about Dak Prescott. He was not planning on that injury that day. That's the sport, that's life. That's what happens, whether it's sport or other activity. But we can control those non-contacts a little bit more if we actually put a little bit more effort and focus into them. So it's a fun topic. It's one that we're seeing talked about a lot more now, which I think is really key because we just see the numbers and we see the data about how much we're actually spending on these surgeries. So just being able to, again, recognize these things, maybe talk to your athletes about them if you work with athletes, dancers, whatever the case might be, it's really important and can really help. So what questions, do you guys have any questions for me in regards to non-contact ACLs or anything that we talked about? I am all ears. And then if people who are watching this recording have any questions, shoot me an email and I'd love to chat about whatever question you have. Any questions, any questions? The PowerPoint is going to be uploaded to Blackboard. In fact, what I was planning on doing was after this conversation, after our lecture here, I'm going to actually upload this to YouTube. And then what we're going to do from there is I'm going to actually send you an email with this video, the PowerPoint, and a few just fun, just for shoots and grins, YouTube videos of ACL tears. And I'll send that to you in an email after this lecture is over. So you will have this in hand. Amanda, so she said she treats a lot of this injury. Yeah, I was actually amazed. My year at Advanced, I saw more ACL tears rehab. I mean, I wasn't even there that long and I saw over 10. But then I think about all my rotations, all the different exposures that I've had. It's like I saw at least 2 or 3 each season of one sport. So, I mean, I'm thinking about Union. Whenever I was there, there was like 8 to 15 ACLs in one season, and I was just amazed.
I think the majority of people that I see are them in another 20 to 30 years.
Yeah.
I mean, it's like they don't come back from those kind of big tears very well. I mean, if they don't get good treatment early on and actually like treat it and let it heal, then it turns into a lifelong chronic pain.
And I love your point because that was something that I didn't touch on. And maybe I need to add this in on the next PowerPoint, my updated PowerPoint. This injury if you do not take the time to rehab it, it will bite you in the butt. And a lot of them, their question is, when can I get back to play? And I'm like, I will tell them the data. And I actually had a girl, she got mad because she like went to her parents and she was like, this girl, she told me, you know, I should be doing this, this, and this. And I was honest with her. I just told her, here's the data. If you're returning back to play before, I think I told her 9 months was the thing that I just recently read. I forget the numbers right now, so forgive me. But I was like, it does heighten your risk. Now, what we're doing right here, of course, I backed it up with, you know, what we're doing here is actually going to help you get back there if that's what you're wanting to do. But I'm just telling you, I was educating her on the risk, because there is a risk and they need to know. But you'll see that
They're
re-tear.
young and invincible. They
And then not only that, but they're re-tear the other leg. It's like they will one and then the other leg will follow.
Yep, that's the unfortunate truth. But hey, it keeps me in business.
Right? That's what I say. I'm like, well, I'll always have an awesome job, you know, and just treat ACLs all the time, which is unfortunate, right? Like
it is. Because it's painful and it's not something we can really fix once it's chronic. It's just more surgeries.
Yeah, and because every time that you go in and you have that surgery, you're exposing that area to oxygen. You're heightening your risk for increased arthritis, things of that nature.
Yep.
James says, this injury is probably one of my biggest fears during the busy season in the service industry. Yeah, because you think about it, it can take you out for a while. Of course, any injury can do that. But with ACLs, like with what Amanda was talking, that re-tear rate, I had a friend who played soccer, and she has probably had 2 or 3 ACL repairs on one leg and then at least one on the other one. And I mean, she's my age. She's older 20s, younger 30s. And so you can just imagine,
that's awful.
Going to be singing you later, you know?
Yeah. I had a patient come in the other day that she's 28 and she's on the way right now because she has had injuries all through school and sports and riding horses. And I think that she said that she's already had a hip arthroscopic surgery. She's had a spinal surgery, and now they're looking at both of her. She's got patellofemoral on both knees, and they're looking at having surgery on both of them.
Ooh.
It's just, and she's 28. It's like, you're gonna have a long life of this, girl.
Well, that's the frustrating part, because if you think about, you know, those developmental years, that time that I talked about, the 12 to 25, right? Those times of hormone changes for both men and women. And then they do a lot of activity. And if they do not get correct guidance on how they're doing those activities, or those muscle imbalances, like sounds like with your lady, she definitely has hip issues, hip strength concerns. It's going to set you up for that long term. I was one of those people that was chronically injured for so long. And until I took a step back and decided that, you know, running 50 plus miles a week probably wasn't good for what I needed. I needed just strength. Once I did that, poof, all my injuries were like, awesome, they're gone. And they just started slowly pulling back. And so I saw it in myself, but I've also seen that in patients. And so taking that time to rehab or strengthen and get those fundamentals, especially at a young age, you're right. She wouldn't have that problem if they probably focused on that more at the beginning of her career.
Yeah. So. I think unfortunately she probably came from a background without the resources, and I think that's where a lot more of the injuries come out of these schools too. That they don't have teams like you at Union or Jinx, and you know they've got sports teams and people that are trained in this, and a lot of these small schools do not. And it's a matter, they've got their star team players, and it doesn't matter what the injury is, they need to get them back out there on the field. And it's an unfortunate cycle that just keeps going.
And you see that a lot more.
Sorry for rambling.
Yeah, you see that a lot more. I'm at Sequoia, little dinky school outside of Claremore, right? Like super small.
Okay.
That stuff, you know, they don't have a lot of the, I don't want to say this experience, that knowledge present. So they work with what they have.
Mm-hmm.
And so that's where you see a lot of that. And it's unfortunate, but it is the reality. And so when we see these numbers, especially, I'm kind of excited about updating this PowerPoint because the research that I've been doing, the numbers are like, I don't want to say that they're getting any better. I wish that I could say that they were. They're seeing the numbers get better if they're actually doing those preseason programs. But if they aren't, and they're just focused on whatever sport it is, and they forget to do those little bitty things that they could incorporate, we're seeing those numbers increase because it's not like our lifestyle is changing. Like, we're still very sedentary, especially with COVID. So that'll be an interesting one, is with COVID. Think about that. The kids who were on the couch for a while and then went back to sport, or maybe their practices aren't.
They're not going to ease back into it. They haven't had their summer practices. They haven't had like all the training that keeps going into it, and they're going to expect that they can go right back into what they were doing.
Yeah, it's a thing. It really is a thing. But yeah. So any other comments or topics that you'd like to bring up? But now I actually like that you brought that up, Amanda, about re-tear rates, because it's just, especially once you have one, and then if the rehab professional didn't focus on both legs and getting both symmetrical, or both, not symmetrical, but strengthening both sides, then the other leg is now weaker because you put so much focus on the rehab side. So it's just getting that foundation, especially because you can have one ACL tear and be okay if you're rehabbed appropriately. But it's just that if you're rehabbed appropriately, asterisk that.
The numbers that they gave us in school was that just basically whenever you have a ligament or tendon injury like that, too, that it's you only come back to 80% of the strength. That was the percentage that they gave us, and that's why it's so. Once it's been stretched that much or torn, especially, that just it's one always susceptible to that. But the same thing as far as like your ankle sprains and all those other things. It's just it's already got loose. It's now loose, and there's not. We can't get it 100%, but we can get it close. So
yes. And I have those conversations with my females that I work with, especially with that conversation. We might not be able to get it 100%, but somebody said, so Misty, she said, I have a friend who tore his twice, and I think he told me that now he doesn't have an ACL. So this is a good conversation to have too.
Yeah, that happens.
You have to have ACL surgery. So Kathy Dooley and I had a conversation while I was staying at her place up in New York a long time ago. And there was the conversation of, when should you say that you don't have to have an ACL? Now, if you, let me put an asterisk right here and just say, if you're a professional athlete, or if you are somebody who has those types of movements every single day, where you're planting, twisting, stuff like that, you're probably going to need an ACL. But there's not a lot, but there's more data coming out about how some people are getting away with not having ACL surgery. And they're just instead focusing on basically the structures that are still there, the musculature that's still there, and getting that to be 150%. It's a thing. It's kind of cool. Some people, they don't have to have an ACL, or they still, they say that they don't have an ACL. What they might mean is that it was torn and then never repaired. Sometimes we see that ACL lay back down. Now the chances of that happening are, 0.001% ish, but it does happen, especially if you do your diligence, which most people won't. They just want surgery, the quick fix. So it's more of you're playing the long game. So somebody says, where do ligaments come in, or 3D pin? So a lot of the newer technology, I think that they're still kind of figuring out what they can do. Right now, you'll have your cadaver ACLs, or maybe some people have them rejected, but a lot of people, it'll take it from, your hamstring tendon, so your semitendinosus. Maybe they will take it from your patella tendon, places like that, to get your actual graft from, so it's actually coming from you, it's less likely to get rejected within the body. But you can have cadaver, and I think that there's a study that I read, sorry the numbers are not here in my brain, but it basically said that, you know, cadaver, those numbers were not as good. However, taking from like your hamstring or patella was a little bit higher on acceptance and then adherence and longevity. So, you know, whatever the case might be, and you got to think about how your body's going to start repairing itself and healing. And if you could keep that strong and keep that good for 5 to 10 years, your body's going to start really replacing the tissues itself with healthier tissues. So it's kind of, if you can get that long game in and you can prevent getting another ACL tear for 5-10 years, your chances increase on success rate. So like I say, I can't remember the numbers, and I'm so sorry, you guys, but I'm going to have to go search for that study again, because that was going to bug me. But yeah, so that's something to keep in mind is, you know, where are they getting the graft from? Is it your own tissues or is it somebody else's? But yeah. Okay, any other questions, you guys? Great ones, as always. Great conversations. I am going to, what I'm going to do is I'm going to stop this recording, put it up on YouTube, have it uploaded, and then before I leave here, I will have it emailed to you guys, and then the rest of your class. So hopefully you guys have a fantastic evening. Stay chilled out. I know it's a stressful time for everyone, and take some deep breaths, go outside, enjoy some fresh air, and hopefully get a good night's rest tonight. And hopefully we will make it to next week, because I know that we will. It's just, you know, a little stressful in between. So have a great night, you guys. I will hang on here for a little bit longer, and then, yeah, we'll chat with you next week. All right, guys, have a great one. See ya.